welcome to this EPF webinar on understanding patients' rights in the European health data space. I see people are still joining. We are now at over 100 participants. Either way, I think people are very eager to hear from our speakers today. Thank you very much again for joining. My name is Flavia Topan. I am Communications Manager at the European Patients Forum, and today I will be your moderator. Before moving forward to the presentations and the interventions from our guest speakers today, I would like to go through some housekeeping rules, very short. You will see that the chat section of this webinar has been disabled, but the Q&A one is working. So we will take questions after each presentation for about 5 to 6 minutes. You can write your questions in the Q&A sections, and you can also upvote questions. So we will see if there's particular interest for some questions, then my colleague Milana, who will help me moderate this part, will take your questions. At the end of this webinar, we would also like to hear from you. It's a very short 3-question survey. This is very important for us because we would like your feedback on the topic discussed today and our approach to it. So moving towards the topic of today's meeting, the European Patients Forum has been actively engaged with the development of the European health data space since the first legislative discussion started. We have always emphasized the need for a patient-centered approach to ensure that the initiative benefits all the individuals across the European Union. Over the years, our advocacy has been centered around ensuring that this system is designed with and for patients, promoting empowerment, equity, and trust in the digital transformation of healthcare across Europe. Of course, alongside our policy work, EPF has also launched the Data Saves Lives initiative, which is now in its sixth year of activity, but my colleague Milana will tell you more about this during her intervention. Now, with the implementation of the European Health Data Space well underway, I think the time has come for us to focus on patients' rights, some key aspects of the EHDS, and the practical changes that the regulation introduces. As this is the first ever health-specific data network, it builds on existing legislation to establish clear rules, common standards, practices, and digital infrastructures. Today's webinar, as I previously mentioned, is an educational one, focusing on patients' rights and the changes coming with the regulation. Hopefully, you will have, at the end of this discussion, a clear explanation on how EHDS enhances personal health data access, sharing, and security, while highlighting the role of patient organization in this implementation. We will additionally explore health data literacy efforts, which are needed to ensure that patients and citizens can fully understand and exercise their rights under this legislation. And today's webinar will bring together several different perspectives on this legislation. We will welcome interventions from the European Commission, from our team, from EPF, and the Belgian Health Data Agency. Let's begin with our first guest, Martin Dorazil. Since 2019, he has served as Deputy Head of Unit Digital Health and European Reference Networks at the European Commission's Directorate for Health and Food Safety. In his presentation, he will guide us through a comprehensive overview of the EHDS, explaining how what it is, why it matters, and how it aims to transform healthcare for patients and citizens across the EU. I believe he will also explore the rights of patients under the European health data space, and will touch upon the practical implications of the legislation. So, Martin, the floor is yours. Thank you.
Thank you very much, Flavia, and good morning, everybody. It's a real pleasure to be with you today, and I will try to do my best to present the European Health Data Space initiative, which I believe has a potential to fundamentally change the way how the healthcare is delivered to patients in the years to come. So I will kindly ask you, Flavia, or your colleagues, if you can share the slides that I prepared.
I believe it is my colleague Dalila, and it might take a bit of time because it's a long presentation.
Okay. I will start in the meantime whilst the slides are being loaded. So the European Health Data Space is an initiative on which we in the European Commission, together with all the stakeholders, including patient representatives, worked for several years. The Commission proposal was presented in May 2022, after also preceding period of consultations and preparatory work. And then the Commission proposal was discussed by the European Parliament and the Council of the Member States. And finally, they reached an agreement, and the text of the regulation on the European Health Data Space was published on 5th of March this year. So the initiative is very recent. 20 days after its publication, so on 26th of March 2025, the regulation enters into force. It doesn't mean that the regulation and all the rules that are included in it start applying immediately. There is a certain transition period envisaged in the regulation, and I will talk about it a little bit towards the end of my presentation. But in any case, the text of the regulation is now finalized, publicly available. It can be downloaded from the website of the publication office. And all the stakeholders, so including patients, healthcare providers, the member state authorities, should start preparing for its entry into application later on. Next slide, please. The European Health Data Space is essentially structured along three main pillars. The first one is what we refer to as a primary use of health data. So essentially, this is use of health data for the delivery of healthcare to individual patients. And in that part of the regulation and the EHDS initiative as such, we are aiming to improve patients' access to their health data and also ensure seamless exchanges of this health data for continuity of healthcare. How are we going to do that? How are we going to achieve that? Through strengthening patients' rights on defined categories of their own data. Also through an obligation on the member state authorities to set up services, easy to use for access to data, but on one hand by patients, so that they can easily access their health data in electronic format, and also by their health professionals on the other side. This work in this area is not starting completely from scratch, but it's building on existing voluntary collaboration among the member states through the so-called My Health at EU digital infrastructure. But the European Health Data Space is not touching the national rules on provision of care. This, of course, fully remains the responsibility of the member states, as remains their responsibility to management of healthcare systems. It just provides a clear framework for the use of health data. Next slide, please. The regulation also has other two pillars. I will mention them only very briefly because I think for the purpose of today's webinar, the first one, the primary use of health data, is much more relevant. But for the sake of completeness, the second pillar of the European health data space concerns the secondary use of health data. So in other words, reuse of health data for research, innovation, and also public interest purposes. For example, for the reuse of health data by the public authorities for policymaking or for their regulatory decisions. In that part of the European health data space regulation, the regulation sets out common European rules on who has to make which data available for which purposes and under which conditions. The regulation provides for a common digital infrastructure for access to this data, even in cross-border situations. So, for example, for research projects, when the data sets that the researchers are looking for are currently in several different member states. The crucial elements or points for the secondary use of the data under the European health data space will be health data access bodies, which will be new member states authorities responsible for managing the whole system for access to health data for secondary use. The European health data space will make it easier for the data users. So again, for example, for health researchers to identify the available data sets through data catalogs, where the descriptions of the data sets will be included, and it will make it easier for the data users to search for data sets that they need for their projects. And the whole system will be used on the decisions and supervision of the health data access body. So they will be issuing permits if all the requirements of the regulation are fulfilled. Permits for access to the data under the very strict conditions. The data will be anonymized or pseudonymized, and there are many other safeguards regarding security of the data and privacy and data protection. Next slide. And finally, the third pillar of the European health data space regulation is harmonization of the rules for the electronic health record systems. So the slide I believe is still loading, but in that part, essentially the regulation is setting out common requirements for the electronic health record systems. And in that way, it really creates a level playing field, so internal market for these products, and will make it also easier for the national health authorities and for the healthcare providers, for example, when they are procuring these electronic health record systems. And as I said, this is mentioned today just for the sake of completeness, and I will leave this aside for the rest of my presentation. So I'm now coming back again to the first pillar, and that's the primary use of data, which is the most important part with regard to patients' rights and benefits that will be provided to patients. So what are the expected benefits for the patients and also for healthcare professionals regarding the primary use of health data under the European health data space? For patients, once the system is fully operational and the rules are in application, they will have quick, easy, and free of charge access to their electronic health data in the priority category. So it concerns specifically defined categories of data. I will show you the list of these categories a little bit later on. It will also mean for patients a possibility to easily share their data with their treating health professionals, including in cross-border situations. So they will be in better control of who can have access to their electronic health data. And they will also be able easily to add data to their electronic health records, restrict access to the data if they do not wish, for example, certain health professionals or certain individuals to access the full electronic health record. They will also be able to see who accessed the data, so an improved transparency, and they will also be able to ask for rectification of errors if they appear in the records. For health professionals, this will mean easier and quicker access to the data of their patients that they are treating. So it will make it much easier and better for them to provide the right treatment and diagnosis to their patients, including cross-border situations. And it will also make it easier because the data will be provided in the European Electronic Health Record Exchange format. So in a harmonized format, it will make it easier to share this data across systems, and it will improve the interoperability of the data. Next slide, please. So what are the rights of the nation? Well, we refer, I mean, in legal terms, we refer to rights of natural persons in primary use of data. Essentially, these are rights of the patients, but also to individuals, in general. So according to the regulation, the patients will have access to their health data. They will be able to download a copy of their data, view who access their health data, set access restrictions if they do not wish their data to be accessible in full. Also, an important safeguard for the individuals is the possibility to opt out from the data sharing, where this is enabled by the legal system of their member state. They will be able also to insert information into the electronic health record systems. They will be able to appoint an authorized person on their behalf to access data, for example, in situations where they are unable to do it themselves, and also request rectifications. This should be made easily accessible to them. There is an obligation in the regulation for the member states to set up health data access services. So for patients, in plain language, there should be a portal or an application through which patients will be able to easily exercise all these rights. And now I'm coming to the point of the possibility to share the data. So the patients will be able to download a copy of their data and provide that copy to the healthcare providers and the health professionals of their choice. So the health professionals will have access to the data through another, access service. So the professional facing service, or another portal or app through which it will be easily possible for professionals to access the patient's data in an electronic format. Next slide, please. As I said, these patient rights currently, has certain limitations. So all these rights are limited to the categories of health data that you can see on this slide. We refer to them as the priority categories of health data, and they are also divided into two groups. So the first one is our patient summaries. So it's let's say a shorter version of the electronic health record, including information on the patient's anamnesis, vaccination history, medication, previous medical events, and so on. And also electronic prescriptions, and linked to that electronic dispensations of medicines that are being prescribed to patients. Why they're in group one? Because the work on the common specifications on these categories of data is most advanced among the member states. So also access to them under the EHDS will be provided quicker. Essentially 4 years after the entry into force, so in March 2029, the access to these data in the priority category group one should be possible. In the second group, where the access will be provided a little bit later, so 2 years later, we have the medical imaging studies and related imaging reports. medical test results, including laboratory tests and related reports, and also discharge reports. Next slide, please. I mentioned the access services, so just very briefly, I mean, to touch upon that. So as I mentioned, I mean, there will be a patient-facing access service in each member state, which will allow easy access for patients to the data and to the exercise of their rights that I mentioned before. And there will be also a access service that will be facing health professionals, so allowing health professionals to have access to the data of the patients under their treatment, and with strong safeguards related to their authentication and privacy. Next slide, please. In this area, and this applies especially to the cross-border situations, because the system under the European Health Data Space will enable also access to the health data in cross-border situations. So, for example, when a patient is in need of medical treatment in another country whilst on holidays or for traveling for work purposes or other purposes, or long-term stays in other countries. And there we are not starting from scratch, but we are building on existing corporations. So there is already a voluntary system being built by the member state, the so-called My Health at EU digital infrastructure, that already today allows in the countries that already participate in the system on a voluntary basis access to their patient summaries, and also, for example, a dispensation of medicines on the basis of electronic prescription in other countries. So currently we have 15 countries participating in this voluntary system to a different extent. Other countries are planning to join soon, and as I said, by March 2029, it will be mandatory for all 27 EU countries to be part of that system, and enable also cross-border exchanges of health data. Next slide, please. And so far I spoke about the benefits for patients stemming from the primary use of health data. Very briefly, I will also mention the secondary use of data, so the reuse of data for health research, innovation, and health policy making. Obviously, even though I will not go into the technical details of that part of the European Health Data Space, there are expected benefits for patients in the long run, because by better access for researchers and innovators to health data, we expect the health research to advance much quicker, and therefore in the long run, this will mean new and better therapies and treatments for patients, and also improved transparency for patients about how their data are being reused for these secondary purposes. I should emphasize in this context that for the secondary use of health data, access to data will be enabled only in an anonymized format, and in exceptional circumstances for specific projects, it might be authorized in a pseudonymized form, but never, the users of the data will be able to access personal data of the patients, or take them out from the secure processing environment that will be made available to them by the member state authorities. Next slide, please. You can go through all the animations on this slide, but this I will not go, in view of the time, not go through the whole slide here. This is just to show basically the structure of the process under the secondary use of data, how, for example, the health researchers will be able to identify the data they need and access them under the safeguards of security and safety. We can go to the next slide immediately, and I'm going to the final part of my presentation. Well, okay, it will take some time before all the animations are gone, But I will talk in the meantime already about the transition. So by when will all of this happen, and how do we get there? As I mentioned, the regulation just entered into force. So we are now starting the period of implementation and preparing for the full rollout and a full application of the European Health Data Space. In a nutshell, for patients, it means that 4 years from the publication of the regulation, so in March 2029, they will be able to use the health data access services that I explained and exercise their rights for the first group of priority categories of data. So exercise rights related to their patient summaries and also to the electronic prescriptions. And 2 years later, in March 2031, they will be also able to exercise these rights to the second group of priority categories of data. So the laboratory results, imaging reports, and also the hospital discharge reports in electronic format. For healthcare providers, this means that by March 2029, they should be connected to the national contact points, and also they will be able to use the health professional access services for the patient summaries and e-prescriptions. And for all the other priority categories of data, they will have the same possibility as of March 2031. So final words, I mean, on the process of the implementation now, because I mean, one part of the story is over now. We have the clear rules of the game. We have the regulation published, but now we are entering probably even more important phase to make this a reality and implement this in practice. We are preparing a number of technical specifications, in the form of the so-called implementing acts. And in preparing those, we are trying to work as much as possible with all the relevant stakeholders and their stakeholder organizations, including patient organizations. So we have 2 joint actions preparing the ground for the implementing acts and working on the first drafts of the technical specifications. One in the area of primary use of data. The name of the joint action is EHR, and another one in the area of secondary use of data, so-called TEDAS2 joint action. For both of these joint actions, we agreed with the project consortia, and it was one of the conditions from the Commission is that any document or any final deliverable before it is finalized will need to undergo a extended consultation with the relevant stakeholders. So either a targeted stakeholder consultation or even a public consultation. So we are very much interested in the feedback from the different stakeholders, including the patient organizations. And with that, I would like to very much encourage you to follow these developments and be involved in this preparatory work, because it will make it much easier later on to make things happen in practice. With that, I will conclude this part of the meeting. Thank you very much.
Thank you for your intervention, Martin. I think we're running a bit over time, so I think we just have time for a question or two. And this is where Milana will jump in and help me moderate the questions.
Thanks a lot. As we are running a bit late, I think maybe we can do the presentations and then have a few minutes for the questions so that we are sure that we can do the next 2 presentations as well. And then because some of the questions can be answered by maybe the Commission, maybe by Steffi, maybe by me. So maybe we can leave it for after the presentation. I hope that's fine.
Okay, then we move on to the second presentation. And actually, it was something Martin mentioned very early in his presentation, that the Commission sees that strengthening patients' rights is a key pillar to a successful implementation. And I think this is where EPF's work complements actually what's going on in the Commission, because you will see my colleague Milana will present a toolkit we have prepared for this topic. Milana, thank you.
Thank you very much. I hope you can see my slide properly. Yes. Thanks a lot, Flavia, for that kind introduction, and welcome to all of you also from my side. Today, I will present one of the educational resources on the European Health Data Space that we have created as part of our Data Saves Lives initiative. So for those of you who are already familiar with our initiative, you know that yes?
I'm sorry to interrupt, maybe it's just me, but I am seeing a black screen. I don't know if...
You cannot see my slides? Maybe then, Dalila, if you can share. Apologies. Yeah, so maybe I can also continue. So we already had prepared some educational materials on topics such as digital health in the past, and you can see them. Let's see where the slide is. So the next slide, please. Perfect. So in the past, we have created a toolkit about health data. It's really about general info on health data topics that actually can be useful also for those who are trying to understand the European health data space better. We have one on artificial intelligence, one on community-led patient registries, and then finally, we believe that the perfect successor, let's say, to these toolkits was one on the European health data space. If Dalila, maybe you can just go to the previous slide, because yes, exactly. So the reason why we felt that this was needed, so a toolkit on the European health data space, is because we believe that improving patients and people's digital health literacy will be essential to make sure that EHDS delivers as we hope it will. We have this great framework, the European health data space, but without actually patients and citizens understanding properly how it works and what are their rights, then we only have we are just making it less valuable for everyone else. So what we're trying to do, it's not just the creation of the toolkit, we'll also try to translate and localize it a bit more, so that we reach to different also member states and communities in different member states and different languages. But unfortunately, at the moment, we're not able to do so, but we will be trying to do so in the next months or in the next year. We're also trying to strengthen a bit collaborations with regional, national, and European institutions on this. And we are also in the process of creating a leaflet for healthcare professionals and patients. This is a joint collaboration with the Standing Committee of European Doctors. So we are trying actually to do these joint efforts in the and we are trying to explain the EHDS in lay language to both healthcare professionals and patients, with, of course, dreaming to have it in hospitals and doctors' rooms as well, so that people can see it there. We're also trying to explore how we can do an explanatory video in collaboration with some of our national authorities. And of course, we are always happy to do capacity building and informative webinars on this topic. So we can go to the next slide, but not the one on the toolkit, so we can skip it and we can just, so this slide, exactly. So here, this is the cover of our new toolkit, and I just put here a very, just a screenshot of what we have in our table of content. So we have this introduction / overview of the European health data space, where we try to explain what is it. We also talk about the drivers behind the European health data space and why we needed it, especially from the patient perspective. Then we move to the difference between primary and secondary use of data, and we really try to focus on that, so that there is this clear definition of how the data will be used for primary and how data will be used for secondary use. Then we move to control mechanisms, such as the opting out from sharing the data, and we also offer some insights into data privacy and protection. And then, of course, we did not forget about patient organizations themselves, so we try to also explain a bit what can be the role for patient representatives in the European health data space. Next slide, please. So this is one of the disclaimers that we have in the toolkit, and we felt that it was needed, that we needed it there because we can only offer at the moment a general overview of this regulation. Many things, so how the EHDS will be applied in each country are also linked to some of the national legislations, but also for the fact that there is some room for member states to actually decide how to implement specific things. So we can only provide this general overview, but for very specific member states, cases and applications will come only later on because the implementation has already started. However, as Data Saves Lives, we're quite happy to work on that as well, together with the member states, so that patients and citizens in different countries can understand how specific things are working there exactly. Next slide, please. These are some of the pages that we have in the toolkit. We try to use as lay language as possible, although it's quite a technical regulation, so it's also a long toolkit. But for those people who just want maybe to focus on what's most important on that page, we also have these boxes that are in blue in this case. So if someone just wants to briefly understand the difference between primary and secondary use of data, they can look into that. But if they don't feel like going more into detail, they can skip some parts of the toolkit. So we also try to design it in a way that one can only see very limited amount of information or more information. In terms of control mechanisms and data privacy, we also divided it by primary and secondary use, trying to explain what does it mean for patients and how actually we can have these control mechanisms within the framework. Next slide, please. This is a very short timeline of the implementation, similar to what Martin was saying. We did not include all of the specific details because we just wanted to include what might be most important for patients and citizens. So you can see the kind of the delineation of the timelines and the implementation and what will happen in the following years. We also tried to explain a bit what are these new governance bodies that are introduced by the European Health Data Space, so the Digital Health Authority and the Health Data Access Body, and also how they will function or how we can how we can actually be part of some of the conversations that they will have. And then also, of course, we focus a bit on security and privacy, and we try to explain how this can be controlled. Next slide, please. This is a very, actually, I believe, an important part of the toolkit. It's about the scenario. So if this is the first time you're hearing about the European Health Data Space, or if you want someone, or if you want to explain to someone how it works in a very easy way, we believe that these scenarios, so it's like cases of what can happen, can actually be very useful because we tend to put ourselves in the shoes of the people about whom we are reading. So it's about a resident of Austria who goes somewhere, has an accident, and then what happens and how they can actually take the benefits that are in the EHDS. And, so we have 2 examples for primary and 2 examples for secondary use, and they're quite easy to understand. And of course, then we focus on the benefits of the EHDS for patients, so the access, the data portability, the control, and we have a similar thing also for the secondary use. Next slide, please. And as I was saying, we did not forget about patient representatives. So we have the last part of the toolkit where we explain shortly how patients representatives can prepare for this framework. And we also offer some potential activities that can be done. And it is of course, a choice if patient organizations would like to do so. And we are also happy to support as Data Saves Lives on this. The next slide, I believe, is the last slide. So I understand that showing the toolkit like this might not be the easiest way, but this was the only way we could present it in a webinar. However, if you are interested in reading the whole toolkit, you can go on datasaveslives.eu/toolkit or simply on the website of Data Saves Lives. It will pop up there. And we are open to any feedback you might have and any questions and also suggestions for the next toolkit. Of course, if you believe there is something that's missing or something we can explain better, and if you also want to, work with us on any of the potential activities that we planned. Thank you very much.
Thank you, Milana. This is super comprehensive. I see some of the questions are recurrent in the chat, and maybe we will address them afterwards. If it's okay with you, then we will move on to the concluding presentation to conclude today's session. We are now welcoming Steffi Persen. She serves as Health Data Academy Coordinator and Knowledge Manager at the Belgian Health Data Agency. She will present the agency's educational initiatives, which are aimed at empowering stakeholders to better understand the regulation and to engage with it, of course, and the broader efforts to raise awareness and build health data literacy in the context of the European health data space. Welcome, Steffi. The floor is yours.
Thank you very much. Also from my side, thank you a lot for having me. It's a great pleasure to being here. Normally, you should see my screen already, so then I can continue. Yeah, so like already announced, my name is Steffi Persen, and I'm the knowledge manager at the Health Data Agency, and I'm responsible for all learning materials at our HDA Academy. Yeah, here you can see a short presentation of all our learning initiatives that we take. It's different kind of materials. It's about e-learning, it's about a communication message, it's about a short article, but I will go through them very shortly to give much more explanation about each type of material we have provided so far. So the first one is about the e-learning about data literacy. So we published a general introduction to data literacy, and it's based on the DIGCOM framework developed by the European Commission. And the aim is to develop a data literacy strategy plan to increase the data literacy, but also the digital literacy among the ecosystem. And of course, yeah, we are well aware that not everyone has the same amount of literacy skills, and therefore we have a close collaboration with the federal government for public health, with RISIF, or ENAMI in French. Also, the Flemish patient platform is involved, Abromet for the Brussels region, and some other parties. And the aim is to have a local network of digital bodies who stand close to the public, and they can help increase the digital literacy skills of the general public of citizens. So that's a first initiative. Of course, we also have our Health Data Talk series, and in fact, they are short 2-page articles, and each time they focus on a particular topic from the legislation or from a specific perspective. Like for instance, we already have a short article about the industry perspective, looking at the secondary use of data, and some more articles will follow, of course. And it's a nice co-creation between several stakeholders, like the Patient Expert Center is involved, the King Baudouin Foundation is there, some universities like KU Leuven, Ghent University, Cienzano is contributing as well, BMedTech, Pharma.be. So it's a nice collaboration which gathers several backgrounds, several points of view, and it makes a really nice collaboration. Then we are also developing a general EHDS e-learning. So it's a very general e-learning, which it gives a global overview of the different aspects of the legislation, and it's from a broad and a general perspective, focusing on some aspects. Like a first house that we can visit is the one of a family, and they present their health experiences. Like the grandpa, he suffers from some illness, and then there are other family members who have some health difficulties as well, and they just explain how they experience their health data and the EHDS legislation. We also have a doctor's consultation in which the doctor gives some more explanation about the primary use, the electronic health record, and the need for standardization. We also have the research center, and they give a small talk about the data requesting procedure, the strong criteria they have to comply with, how they can obtain a data permit, how they can analyze the data in a secure processing environment, and how they will publish the results of their data analysis. And finally, we also have the city hall, where the city employees, they give more information about the legal context, the different parties involved, and their roles and responsibilities. Like Milana already said, what is the health data access body, what is a trusted data holder, and so on. And in fact, the e-learning is built in these different houses, so the visitors can choose which house they will visit and which information they want to read, and it's all written in a plain and accessible language. We also have an EHDS leaflet, and it's to spread some general information to the general practitioners, to hospitals, to other stakeholders. And we are also thinking about creating some small videos in collaboration with EPF as well, to give some broad information about different aspects of the EHDS legislation. And we also worked on our communication message. We have developed like a comic book to present EHDS legislation and the concrete advantages that every patient, that every citizen can experience. And it's in comic strip view, which makes it concrete and gives a visual explanation of all the benefits that accompanies with the EHDS legislation. And then we also have a working group 7, and the working group is dedicated to brainstorm about what concerns live, what questions do the stakeholders may have, and then we will focus on these questions, and then we will develop it into some more specific e-learnings that will address these specific questions. And here you can see the results. So we try to be in the other stakeholders' shoes and reflect what issues do they have and how can we address them with an appropriate concrete learning as a result. So also to mention, it's also a nice collaboration, and different stakeholders are represented in this working group 7. And that's a quick walk through our different initiatives. So if you want to keep updated about our initiatives and about our projects, please feel free to check out our website. We are the Health Data Agency. We also have a LinkedIn channel for our communications. And of course, visit the EHDA Academy, where all the learnings will be published, where you can visit already some technical but also some general learnings, and of course the Health Data Talk series articles. And please feel free to reach out if you have any questions or suggestions concerning all learning materials. Thank you.
Thank you, Steffi, and congratulations for the comprehensive initiatives you are developing at the agency.
My pleasure.
I think the interest is there. For instance, the attendance today peaked at 180 participants, which shows that a lot of people are interested in this topic. And of course, the very lively Q&A section of this webinar also points to that. And this is where I am handing over to Milana to maybe take some questions from the audience.
Thanks a lot, Flavia, and thanks a lot for all the presentations. There was one question about notifications and how health data, how patients or citizens will be notified that their data has been accessed or shared. So I guess, Martin, if you would be able to reply to that one. Like if there will be notifications or anything like that.
Yeah, no, yeah. Thank you for the question. Before I go into the answer, just to clarify, I mean, the system is not operational today. So many things, many modalities, practical details are being worked out and will be rolled out only in the future. But in general, the answer to that question is that the individual or the patient will be notified through the Health Data Access Service. So the portal or the app that in each member state will be set up and made available, where the patients will be able to access their health data, download them. In the same place, they will also be able to see who accessed their data and possibly also restrict access to their data if they so wish. So that's the answer to that question.
Thank you very much. There was also a question, maybe another one for you. It's about the EU-funded projects, so the Blue Botonic Share, H2, etc. So our participants are trying to understand if this is something that can be in the end part of the European Health Data Space, or if it's a completely side project, and maybe we'll take some of the learnings implemented in EHDS, or how it will work.
I didn't quite get the exact reference to the specific project, but in general, the European Health Data Space, the initiative, is not focusing primarily on collection of the data, but making available or accessible the data sets that already exist. So I suppose the question relates to the secondary use of data and whether, for example, certain projects that are developing, patient registries or collecting data, how they will be linked or connected to the European Health Data Space. And the answer is yes, that data will fall within the scope of the European Health Data Space and can be made accessible through the data requests. Always, as I emphasized, the data will be accessible only as anonymized data, in exceptional circumstances pseudonymized. But the access will be enabled in the secure processing environment, where let's say the researcher or the data user will be able to process the data, but they will not be able to take out from that secure processing environment any personal data. So only the results, let's say aggregated results of the processing, they can download, but under no circumstances any personal data.
Thank you very much. Just for the clarification, the project was Xshare, so it was mainly for primary.
Okay. Well, for Xshare, okay. Then this is certainly being taken into account in the work on the technical specifications for the patient summaries, e-prescriptions, and the other categories of data. We have the joint action I mentioned, XDEHR, that is trying to bring together all existing material from the existing projects and work out the technical specifications.
Thanks a lot. I also have one for Steffi. So there is a very specific question about the updates on the uptake of the Belgian Health Data Catalog, and how it uses the DCAT and links to other EU and other EU initiatives.
So we have the data catalog, and in which is all the data sets, and it's a searchable metadata catalog, and it follows the standards. And you mean if there is an update in the metadata catalog, if I'm correct?
Yeah, if there are any updates on the uptake of the catalog. This was
we are
a question.
we are frequently.
I think we lost Steffi for a second.
Yeah.
I'm still here.
Yeah, now we can hear you.
Okay. In fact, the data catalog is constantly growing as we are trying to onboard as many data holders as possible, and it's quite successful, but we're not there yet. So in the coming months, we are planning to onboard more data holders, and then the catalog will be elaborated even more. So it's a work in progress, and we will communicate about it to make sure that we will spread the message that some new data holders are onboarded as well in our metadata catalog.
Perfect. Thanks a lot. Maybe just a very short one as well. The question about any challenges that you have encountered so far in rolling out all of the things that the agency has done that are amazing.
Well, of course, we are very grateful that we have as many participants in our working groups, because they have their own interests, they have their own concerns, and it's great to have these all together in one working group, so that we are aware of what lives, what exists. And the challenges we have, if I may speak for my working group, is to have the right channel to address the different stakeholders. For instance, the primary caregivers, they play a crucial role, and we have to find the right medium, the right channel to address them, because they don't have a lot of time. And also for the patients, we have to address them correctly in an easy to understand language, and not to use that many technical language, because we want to make sure that they understand every aspect, so they know their rights, and we have to be very transparent and clear about it, and that's something we cannot lose out of sight.
Thank you, and thank you for the presentations, for the thoughtful answers. As I said in the beginning, we will have a very, very short survey for participants. My colleague Dalila will pop it on the screen. You can actually select in the webinar your answers. Again, thank you for our speakers. It was lovely to hear from you today, and thank you for taking the time to be here with our community. Thank you all to all the participants. As I've said several times in the Q&A section, once the recording will be on our YouTube channel, we will circulate an email with the recording and with the links to the toolkit, to the Data Saves Lives initiative, to the materials provided and spoken about from the Belgian Health Agency, and so on. Maybe as a concluding thought to this webinar today, somebody was asking in the chat that for many patients and patient organizations, the European health data space can be quite technical and difficult to engage with. And we were asked if we were thinking about targeted education on or trainings directly on this topic. If we are planning workshops or so on. And the short answer is yes, we do have a lot of plans on this topic. It depends, however, on our capacity, how we will be able to deliver this. We do know it is a very vital need in the patient community. What I can advise the audience is to make sure to follow EPF channels, social media channels, as well as the Data Saves Lives one, because there is where we publish our initiatives on this topic. And if we are to organize something in the coming months, that's where you will definitely hear from us. And with that, I will conclude this webinar. Again, thank you, everyone, and have a lovely day.
Thank you very much, everyone.